Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now today our topic is what type of migraine. So migraine types. So how many types of migraine do we have actually? Many, many types. Many types. So we're gonna talk about how many types and how do you know which types of migraine that you suffer from. Okay, and this is important. Why it's important? Because once we give you a name, then when we say, oh, we have oral migraine, then you know what oral migraine, all the symptoms. But you've been saying, well, if you've been diagnosed with the migraine without oral, then you know what that means that without oral. Okay, if you have watched our video, the second video of migraine, which is we talk about the migraine symptoms, then the migraine come for 4 different phases, right? So the migraine actually, the type of migraine need to follow the symptoms to put in different group, different type. Okay, let's see. Let's just remind your memory, refresh your memory. Okay. 4 phases. The first phases, we call it prodrome. Prodrome phase. Prodrome phase. It could be. It's just something that trigger the migraine. It can be craving food, depression, and feel very tired, fatigue before you get the actual headache, migraine, right? So then it moved to oral. Oral means is another early sign of migraine before it really get into the headache. Before it really get into the head, the oral means that you have speech issue, you can't speak clearly, or you have light, sensitive to light, or you lose your vision. And as well as what it can be your sound, very sensitive to sound. There's oral, or you can see some spot, flashing, white spot, whatever. Okay. Then the stage, third phase, is the attack phase, which means it really happened. Your headache, you know, that pains in here, and with vomiting and nausea, all this thing that really get this. Then the last is post-drum. Post-drum phase is something that we call it's all gone, the headache's gone, or the headache should be maybe still in there a little bit, but not too bad. And it's many emotional issues and two very opposite emotional issues. One is very happy because and very excitement that you don't get any, you pass your headache already. So the other one is feeling terrible that you still have the headache just now and very tired. So those are the 2 different post-drum. Okay, so when we put all IQ holistic solutions, nice to see you again. So we are trying to get when a patient comes, what migraine, this patient's migraine, and which type of migraine, right? So according to the symptoms. So one of them is according to symptoms, right? And this is important. And then I'm going to show you that we have acute migraine, chronic migraine, a few types. We're going to talk about that later on. Hi, Veronica. Good morning, Szenan. Greeting. Look forward each day to hear from you. Thank you. And Suzette. Good morning from India, right? Thank you. Hi, Jordan. Jordan Dew from Auckland. Nice to see you. Thank you for joining us. So if you are on our live video, hi Nida, how are you? Please give me a thumbs up and share this video on your Facebook page as well. And please tag your friends or family who ever suffer from migraine into this group. Okay, you can call me Robert. Haha. C2 Roberto, right? Good to see you too. Thank you. Now, Roberto, I have to remember your name because I only get your name in here. IQ Holistic Solutions. Roberto. Okay. Brain Cam Brain Car. Brain Car? Thank you very much. I may forget your name again. Okay, let's keep going. So okay, the types of migraine. So there are many types of migraine. So two of the most common types, migraine without aura, or and migraine with aura. You know. So what is aura? Simple. We just talk about it. That you have sensitive. You haven't got the pain yet. 4 phases, and the second phase is the oral phases. Oral phases get speech issues, aversion issues, sound. You hear something, you see something, or you can't see anything at all. And you get sensation problem, tingling and numbness on the face, hands, and legs. So headache with is you with this symptom. Without is you haven't got those symptoms that I just mentioned. Right? So that's simple. Right. Okay, migraine without oral. Okay, so this type of migraine used to be called common migraine. Common migraine. It's without, okay, because a lot of people, most people with migraine don't experience this oral. Okay, they don't have it too. They don't have tingling and numbness. They don't see light. They don't get brain. Uh, According to the International Headache Society, wow, there's a society, you see, International Headache Society. People who have migraine without aura have had at least 5 attacks that have this following. Okay, headache attack usually lasting 4 to 72 hours. If not treated, or if treatment doesn't work, okay, headache has at least 2 of the following. It happens only on one side of the head. Okay, pain is throbbing, and pulsating. Or pain level is moderate or severe, and pain gets worse when you move, like when walking or climbing. That's why they have to lay down, and be quiet. Okay, so that's one of them. Headache has at least one of these following. Okay, so that headache attack usually lasting for between 4 to 7 2 hours, and if the patient had any of this, like pain in one side, not whole head, okay, or because some people have whole head pain, and is throbbing, all right, and pain level from moderate to severe, okay, and pain worse when you move, that is either one of 2 of them, okay, a list of 2 of them, okay, and need to plus this one headache at least for has 2 of them, one of them, and the following. Okay, it makes you sensitive to light. That's very common, sensitive to light, and it makes you sensitive to sound. You experience nausea or without nausea, or diarrhea. Nausea, diarrhea, what organ is that? According to Chinese methods, digestive, stomach, spleen, right? Large intestine, small intestine. Headache isn't caused by another health problem or diagnosis. Okay, now as we said about the diagnose in when was it? Yesterday, yesterday, when we talk about the diagnose, no, the day before we talked about treatment yesterday, right? The day before we talked about the cause of migraine is unclear. We don't know, but you have to rule out a lot of things. You know, it's not tumor in there. It's not from the neck. You know, you have to take X-ray, MRI to rule out all this problem, right? To be able to tell, okay, this is migraine. Do some blood tests. You know, go for everything because there is no lab test, X-ray, blood test to tell that, hey, this is migraine. You know, there is no, okay, there is nothing can just simply run a test. You have to come. It's all according to the symptom and the pattern of what's happening, right? Anderson, thank you for joining us. Thank you for joining us. Good afternoon from Venezuela. Such a honor learn from you. Thank you. Thank you very much for joining us. Suzette is from India. Now it's 1 in the morning, 1:25, but don't sleep to watch the class. You should watch the replay. I always say that you should go to sleep. To be honest. Yeah, okay. Please give your thumbs up and share this video to your post and get more and more people come and watch this video. And tag your friends. If your friends suffer from migraine, this is a great chance for them to learn. This is a great chance for them to learn. Tatiana, nice to meet you. Good afternoon from Los Angeles. Thank you. Thank you for joining us. Thank you. All right. Right, we have Instagram and Facebook, and as well as YouTube. A lot of platforms all together. 1, 2, 3, 4, 5 different platforms. Because I opened this, I turn on my clinic Facebook as well as YouTube on my clinic page as well. So we have our patient in here and we have practitioner in here. It's a great chance to share with you. So what about migraine with oral, right? Simple, migraine with oral, right? We talked about that before. Oral phase, anything with the oral phase, then we can put it down. If anyone suffer with the speech, light, see the spot on loss of vision or sensitive, tingling, numbness on the hands and face, and very sensitive to the sound. All this, if you have all these things, you know, then we can put in the, oh, this is migraine with oral. Okay, so this type of migraine used to be called classic migraine. Classic migraine, because not everyone get oral phase, right? But the 4 phases, we talk about that in the symptom. The 4 phases, not people will skip some of them, you know, skip the first one or the second one, or the second one in the third one, attack phase happen together, or the attack phase combined with the first, second, you know, it may combine all together. Suddenly just come, you know, that you don't have post-drum, you don't have oral. But if you came for oral, this is the perfect classic one. Perfect classic one. Who want the name? No, I don't want it because I don't want to have headache or migraine, right? So complicated migraine. This is a complicated migraine. It also called hemiplegic migraine, because when it happens, look, tingling and numbness on hands and face, and speech issues, you know, and one side can't move. What does it mean to you? What does it look like to you? Stroke. Pretty similar to stroke, but it's not a stroke. They run a CT scan. I've seen this patient, and we treated an acupuncture and Chinese herbs, and That was in 2018. I think I want to get this case to do a case study. I keep thinking of that when I come to migraine and talk about migraine. I think so next month, let's just decide it right now. This month, in the end of the month, okay, we gonna do this. Okay, we're gonna the case study for 2 hours. We're gonna do this case migraine. How I treat this patient. How I treat this patient. Okay, I use what acupuncture, Chinese herbs, and I do uh, Chinese tuina. But this treat, I can't say manipulation because manipulation is not in our field to say this. But in Chinese tuina, it got massage technique, it got acupressure point, it got manipulation as well, to adjust the spine. I do that for this patient. And this, guess what? This patient, normally we will use an acupuncture technique with a lot. We have a lot of acupuncture technique, right? We can use scalp needle for migraine, right? For this patient, you can't use scalp acupuncture at all, because scalp acupuncture actually make it worse. And how do I know that? I test it out. Every time I put scalp acupuncture, the pain gets worse. It gets worse. I have to remove the scalp acupuncture and do other needle to subside the pain of the headache. So funny, isn't it? Some people, some patients, just not suitable for scalp acupuncture. But you heard a lot of people say that migraine headache, needle the head, 四神聪, whatever, scalp acupuncture work well, but not in this case. Not in this case. All right, this is the real case. I'm not saying this because I'm not respect scalp acupuncture master, but it's a real case. Okay, but I do use scalp acupuncture to treat a lot of headaches, but not in this case. Okay, but yeah, that's the sign. We're gonna do this case study webinar for 2 hours. It's free, so stay with me, and then we will post on our page and group and let you know how to sign up with this. Okay, we're gonna share this. Yeah, use Chinese herbs, acupuncture, and some adjust technique to treat her. And she was 6 months off work, and then she got back to work. Within 1 month, got back to work. So this type of migraine, right, is called complicated migraine, classic migraine. Okay, migraine with aura happens in 25% of people who have migraine. 25. That's pretty high too, right? 25, but not as high as later one. I'm gonna show you the other one is even higher. So according to the International Headache Society, you must have at least 2 attacks that have this following. Okay, an aura that goes away is completely reversible, and includes at least one of these following symptoms. Okay, first one is visual problem, the most common aura symptoms. Visual problem. You see the light, and sensitive to the light, you see the flashing, or what? You lose your vision. And that, hey, vision problem is on migraine without aura as well, right? Sensitive sensory problem of the body, which means face, your tongue, hand and legs get numbness or tingling. So at least one of the following. Those 2, speech, language. You can't speak properly. Okay, okay. A problem moving or weakness. Okay, which may last up to 72 hours. Okay, this is 4. Okay, and brainstem system symptoms, which include difficulty talking, unclear speech, vertigo. So my patient have vertigo and difficult to talk, unclear speech, and double version, and a problem hearing. She didn't have this ringing sound in the ear, and ability to control body movement, which is imbalance or can't move at all. And my patient have this: one side couldn't move. When it happened, one side couldn't move. Decreased consciousness. Okay, and this patient has tried a lot of drugs, and she was on a lot of drugs, and then I managed to stop all the medication, reduce the medication and stop all the medication, because she is a practitioner herself. She's a practitioner herself, so she know all the drugs, the side effect, and she didn't want to do that. But she has no choice because no one can help her, and she's seen a lot of people, and yeah, she was very happy. So just about, she semi discharge, I would say, because she's still on herbs, just 1 teaspoon a day, and no acupuncture right now. Yeah, and I'll see her in probably 6 months. Maybe I ask her to come back 6 months and let me take your pulse, and then you come back, and then I'll give you some herbs if you need it, but no treatment for her right now. There's no medication and everything. Pretty good. She's managing herself pretty well. Back to work. And eyes problem. It either will be one eye or both eyes. Okay, but it normally just in one eye. It can be both eyes. Like flashing light, blind spots. Something that you can see, but one spot that you can't see. Okay, and or temporary blindness, that you can't see anything at all. Okay. Now, with eye problem, there's another name called retinal migraine, because it comes just with the eyes problem. Okay, and retinal eyes problem can cause headache, migraine as well. Especially if you have high pressure in your eyes. Okay, so one of the migraine and headache is actually causing from the eyes issues. Okay, so in oral, usually occurs before the headache pain begins. Before this. But it can continue once the headache starts. So, which means that 4 phases, right? We know this phases is oral phases. If you have oral phases, then your migraine is migraine with oral, right? So this oral issues, the 4 phases that we just talked about, pre-drum phases, oral phases, and attack, which is you really get there. And by the time you get into the attack phase, which means you have headache, the headache begin. But it doesn't mean that the oral phase is all gone and then you go through this. All the oral phases remain, then you get to the oral phases actually subsides, then you still have the migraine. Okay. So now this is using the oral to tell which type. One type is migraine with oral, the other type is migraine without oral. Now, and the other common thing that we give it to say that which type is it. One is chronic migraine, the other one is acute migraine. Chronic and acute. Simple, right? Chronic migraine used to be called combination or mixed headache, because it can have features of migraine and tension headache. What causing tension headache? Too busy in life, too much pressure in life, too stress in life. Tension headaches, right? It's also sometimes called severe migraine and can be caused by medication overuse. What medication can trigger migraine? There are a lot. One of the common medication is contraceptive drugs. The pill. A lot of women take it, and it can actually cause migraine. And people didn't know that. So when I treat them, I ask them about the drugs. I say, well, if the acupuncture doesn't work well for you, and I want you to stop your drugs, especially contraception pill. And some of them just started a few months, and as soon as they started, they have migraine. I say, well, this is do with your the pill, and you have to go back to discuss with your doctor. And the pill is not something that you must take. I said, go back to the doctor and see how to get it off. And let them know, bring the awareness to them, and because they want to fix the migraine. And funny enough is the doctor themselves, the migraine is actually from the contraception pill. Some of them, but some of the doctors didn't realize that. That's funny, isn't it? I think because the doctor is too busy to run busy clinic, maybe. Okay, people who have chronic migraines have a severe tension or migraine headaches more than 15 days, or a month, or even three or more 3 months, or even more than 3 months. Okay, so more than 8 of those headaches are migraines with or without oral. With or without oral. Okay, so my patient has 6 months migraine. 6 months. She couldn't go back to work. She had to stop work. It's a chronic migraine as well as oral migraine. So it can combine with those two types we just said. Yes, it's an oral migraine as well as chronic migraine. Okay. Compared to people who have acute migraine, so people with chronic migraine are more likely to have severe headaches, more disability at home and away from home, depression, and as well as anxiety, depression, anxiety. So yes, you would think so. Why is that? Because they are a migraine, they're in pain, and they don't know what to do. They lost a job, they stay at home, they cannot function properly, they can't do the normal duty, which people all go to work, and they're alone at home. And they have difficulty to look after themselves, and they're still young, and they're not old, they are not having cancer or whatever, but all those things, and they don't know what to do to fix it, and they don't know where it come from. So of course they worry, they get depressed. Hi Dimitri, how are you? So another type of chronic pain like arthritis. So they may have arthritis. So as well as this, they may have arthritis. You see, so this is important to know. Oh, right. They don't just suffer from migraine. They have other problems. What are the problems? Arthritis, pain in other bodies part. Okay, other serious health problem. Okay, such as high blood pressure. High blood pressure. Now I want to say high blood pressure with migraine because when you are in pain, when people in pain, they actually raise the blood pressure. Okay, my patient just now, I remember she was on high blood pressure medication. Okay, the reason she was on that, they were trying to bring down her blood pressure because when she had an episode of attack phase of migraine, she got high blood pressure. And we understand the reason you get high blood pressure is because you're in pain. But it makes sense for Western doctor to give them drugs. Why is that? Because they are scared it might cause a stroke. You know, the thing about it, the patient have 6 months of migraine pain every day. What do you think? What do you expect? The blood pressure will be high. Yes, definitely. The blood pressure will be high because the patient's in pain. The patient's in pain. So this is important to know. So, but when we treat the patient has no pain and no blood pressure issue. The blood pressure dropped because he wasn't in pain anymore, and the blood pressure dropped down. And guess what? The doctor keep giving her blood pressure medication, and it was lucky that she is a practitioner as well, and she asked doctor the doctor and said, yeah, no, I don't want to take any pill. I She managed her monitor her blood pressure and give it to the doctor, said, you see, I should cut it down. And the doctor agreed. But if she didn't manage, I'll tell you, if you come to help your patient to reduce medication, you need to have a way. You need to have a way to discuss with the doctor. You need to monitor the health. You need to monitor the numbers to prove to your doctor that it's become normal. It was that, now it's this. I ask my patients to take blood pressure, measure the blood pressure numbers twice daily, once in the morning, once in the afternoon. You know, and when you measure twice, then you have a data to show your GP, to show your medical doctor that it's getting better, it's stable. Then because they care about you too, they care about you too. Then they don't want you to have trouble. They want is everything stable, and then you slowly stop the medication. And so when you show them, and all my patients will show them when it's come from blood pressure uh, uh, problem, and show the doctor, and the doctor will agree and show you how to properly weigh off your medication. This is the right way to do it. So do not, if you're patient of me, patient that watch this live video, do not reduce your medication or stop your medication by your own. You need your doctor to support you, and you need acupuncturist. But I have to be honest with you, you probably difficult to find an acupuncturist like me, like what we do in our clinic, to support you, because we have the knowledge. We have the Western medicine knowledge, and we have Chinese medicine knowledge, and we've been there before, and we help patients to reduce medication, and not everyone have the confidence to do it, because it's not just easily talking about acupuncture treatment or Chinese herb treatment. We are talking about more than that, beyond that. What is beyond that? We're talking about how to control your emotional, how to bring your stress, how to do your help with your anxiety and depression, and lifestyle change. We talk about lifestyle change. Okay, without lifestyle change, it's still doable. It takes quite a long time, and it's difficult to get stable. This is my experience. Sorry, it's getting too hot now. I got a heater down there. It's getting too hot in here. All right. Right. So some of the chronic migraine, what we know, migraine here, it can get related to the neck, right? Related to the neck. So if you have previous head injury or neck injury that causing pain in your head, that it can lead to chronic migraine. Now let's talk about acute migraine. The acute migraine is general term of migraine, so that undiagnosed as chronic migraine, which means this chronic migraine, it happened just like this, just like this, right? So people who have an episode migraine and have headaches up to 14 days or a month, okay? So people who have this type of migraine headaches a month than people who with chronic ones. Okay, so it is shorter and it comes very quick, very quick. It doesn't mean that you have to go to those four phases, you know. And with chronic migraine, you can put it down to acute migraine as well. When it's happening, you say, oh, this is acute issue. This is acute migraine. You know, so acute migraine doesn't mean it can use in any episode, any migraine. When it happens, you say, oh, this is acute migraine. You know, in an acute phases, in an acute period. Okay. So vestibular migraine, which means the migraine is associated with vertigo. Migraine is associated with vertigo. Okay, so the chronic migraine is about 25% of people who have migraine, right? Guess what? It's even higher in this time. It's about 40% of people who have migraine have the vertigo, dizziness. You know, the patient that I just mentioned, she has this. 40% is even higher, isn't it? 4 out of 10 people have this type of migraine with dizziness. You know, so what is this? This is like the symptom is like affect your balance, so caused by dizziness. Like you walk and you go like you're on a boat. Okay. Now, people in any age can suffer from this. It can be even children. Okay. Can be even children. And of course, when you have vertigo, a lot of time they come with what? Vomiting and nausea. Okay. Optical migraine. So this is another type of optical. Why optical? Because patients have the eyes problem. Even the pressure is too high, or retinal migraine, or we call retinal migraine. So this is a real type of migraine with oral, but unlike other visual orals, it affects only one eye. Okay, it's not going to both eye. It's only one eye. Okay, in one eye you see flashing light. Okay, and or you have a blind spot or partial loss of your vision. You know, some vision you lost, some you can still see, not clearly. Okay, or just lost vision on one side. That side you can't see anything, or that side you can't see anything, and the other side you can still function. So they call optical migraine. The other type called complex migraine. Complex migraine isn't a type of headache. Instead, complex a complicated migraine is a general way to describe migraine. So it's not a very clinically accurate way to describe them. Yeah, some people use complex migraine to mean migraine with aura that have symptoms that are similar to symptom of a stroke. Okay, which means it's complicated. You can't actually give it a proper diagnosis. It's different with the migraine because it's a complicated migraine. It actually look like a stroke. You know, you have weakness, trouble speaking, loss of vision, all this. So it's another term of what do you call it? Another term of the chronic migraine. Another term of chronic migraine, and migraine with aura, right? It's difficult to tell what it is. It's scary because think about it. If you have migraine, you lost your speech. You know, and what do you have to do? You have to go there, get a X-ray and a CT scan on your brain. Now, there's another common one. This one's very common. You know, but it only happened in women. Okay, it only happened in women. 60% of it, 6 out of the 10 people who experience migraine in women have this problem. The diagnosis in this. What's this? It's menstrual migraine. Menstrual migraine, which when you have your period, you get migraine. Every month you get a migraine. It may not be every month, but every time your migraine happen is actually with your menstruation. You see? So they can happen with or without oral. Okay. And the rest will be the same. So the migraine pain can go before the period, during a period, and after period. And some of them what? During the ovulation, which is 14 days. 14 days before your period, that start happen. And that's horrible, isn't it? That's horrible. So this menstrual migraine has been shown in research that is menstrual migraine tend to be more intense, last longer, and have more significant nausea than migraine not associated with the menstrual cycle. So they get nausea. So in addition to standard treatments for migraine, women with menstrual-related migraines may also benefit from medication that affect serotonin level as well as hormone treatment. Now, when we treat this type of migraine, we need to balance the hormone. Okay, not just treating the migraine. And I know Western doctor will put you on pill. Why is that? They try to skip the period bleeding for you, and that's not what I suggest for, because this is just because when you stop your period, it actually causes other problem. You never treat it. You just run away from the problem. Run away from a problem. And again, when this problem come up, you don't see it as a problem. You see it as an opportunity. As patient, if you're a patient, you see it as an opportunity that your health is running down, and there is something in there causing it. So you see it as an opportunity to get rid of it, so to fix it. Then therefore, you won't have any problem in the future. If you try to stop the period, then what about if you want to have baby? What do you do? You know, if you're a young lady, you know, a teenager, you try to stop your period and they put you on weight. And when they put you on weight, on the drugs or on the contraceptive pill, they put you on weight, then it brings you other problem. If you put on weight, you're at high risk of diabetes, high cholesterol, blood pressure, you know. So this doesn't help, and heart problem, and may give you stroke. So you're just running away from a problem into the other problem, you know. So you create the other problem for the body. So this is not a treatment. You're just running away from the problem. So I see it as an opportunity for you to get better. And yes, for your patient, for our patient to get better. It's an opportunity for us to work with patients to gain their health back, to help them. According to Chinese medicine, we have a way to help them. We have very, very different system than Western medicines. Okay, so we can help them. And of course, again, we offer lifestyle changing, right? So hormonal migraine, again, hormonal migraine is another menstruation migraine. Why hormonal migraine? Because we can't put it in menstruation, menstrual migraine, because some patients, they have migraine, is they haven't got the migraine. But menstrual migraine is to do with hormonal migraine. But you can't put all women migraine into menstrual migraine because they menopause. They no longer have period, and when women in menopause, they may suffer from migraine, and therefore we put a hormonal migraines. This is a type. Okay, it's commonly to do with the estrogen. Okay, now of course, to do with estrogen with a period. If you have a period, then we can put it on this type. This is a hormonal migraine, as well as menstrual migraine. When the patient comes because of the migraine is due to the menopause, your diagnosis will be hormonal migraine. It won't put a menstrual migraine, right? So make it so clear, okay? And I do want to say hormonal migraine is to do with the period. It may be ovulation, pregnancy, and pre-menopause or menopause. Okay, or when you start your pill or stop your pill, a birth control pill, and it happened. But we talk about that some pill can actually get you migraine, right? Like we call overuse medication migraine. And some people on a hormone therapy, like they go through the hot flusher, sweating, and menopause symptoms, and doctor put them on the drugs, hormone therapy, and that actually cause headache, cause migraine. They used to have migraine, but now they don't have it. But now they suffer from menopause, sweating, and hot flusher. And the doctor said, well, okay, it's the hormone imbalance. So let's give you some pill, hormone therapy. And the patient take it, it trigger the headache and migraine. They used to have it, but they haven't had it for a while. As soon as they take the pill, they start to get migraine. So therefore, the doctor need to adjust your doses of the medication or change another pill for you. This is what they normally do. Or change the type of the pill of the hormone, right? Or just stop the medication, stop the hormone therapy, and go to acupuncturist, Chinese doctor, homeopathic, naturopath, whoever can help you do some alternative therapy, alternative care. You see, so yeah, this is what we talking about. There's a lot of other migraine, like migraine insurance, cluster migraine, stress migraine. Easy stress migraine is related to stress, okay, and tension headache, similar to tension headaches, okay. Migraine in children is just happen in children. There's not a cycle. Abdominal migraine. Abdominal migraine is when you suffer from migraine, you get vomiting, you lack of appetite, and you get diarrhea, and of course you will still get sensitive to light, right? Or you get constipation. All this thing is called abdominal migraine. Okay. And as well as pain in the stomach and the abdominal. You get very uncomfortable with the abdominal as well as migraine. So they call abdominal migraine. Abdominal migraine. So there's some migraine happen with pregnancy. Pregnancy. So patient get pregnant and they happen migraine. Why is that? Because when you get pregnant, the progesterone and the estrogen that makes change, fractionally. So what happened there is they start to get migraine. But in this case, I want to let you know a lot of patients they didn't want to take pill because they worry that harm the baby. The painkiller, they don't want to take it. They just bear with the pain. Okay, so this is another type. So this is important too that you know that people get pregnant, they may get migraine, and how do you treat it? With acupuncture or with Chinese herbs or with acupressure point? Because some Chinese, like this point, we won't use it for that. You probably use this for all the migraine. The first point, that's last intestine fall, 合谷. But in pregnancy, you can't do this point at all. Okay. Migraine, I think that's it. We finished all today mission. Okay, this is all the type. You see, wow, I never had any disease so far. Not in arthritis, we don't talk about that many types, you know. And this will try to cover a lot of types of migraine for you and to give you information what they do. Okay, so over my time now is 51 minutes right now. We just do it for an half minutes, right? I know, half an hour, right? But we get more. Very grateful to you, Szenan. Have a great day. Thank you. Veronica, support me and being with me every day and here. Thank you very much. All right, that's it for today, and I'll see you tomorrow. And tomorrow we're gonna talk about what topic? Let me see. Yeah, we're gonna talk about what can you do at home. What can you do at home? It's a home remedy, like treatment at home. Migraine treatment, like we're gonna talk about acupressure point tomorrow. What acupressure point can you do for migraine? That's tomorrow topic. So stay tuned. I'll see you tomorrow. We talk about tomorrow. Okay? Have a great day and stay awesome. See you next time. See you tomorrow. Let me close down every of my platform. So leave a message if you think this is helpful. Let me know this is actually helpful. I would like to know. Thank you very much. Leave a comment there and let me know